Assalamualaikum warahmatullahi wabarakatuh. Today our group will present about poultry disease avian tuberculosis. First of all, I will introduce our group member. First, Mohammad zainolhasan bin Rosli. Second, Nadia binti zawawi. Third, Syarifah binti abdul ghafar. Fourth, Siti qibtiyah binti rushdan. And last, Rabiatul adawiyah binti rozlan. I will pass to Siti for her part, which is introduction about avian tuberculosis.
Assalamualaikum warahmatullahi wabarakatuh. I'm Siti binti Rushdan. Today I would like to present about our topic. It's avian tuberculosis. For introduction, poultry tuberculosis is predominantly caused by Microbacterium avium. Tuberculosis is a chronic disease occasionally seen in small poultry flocks. Game birds like pheasants, quail, and partridges, and rarely in the commercial poultry. Avian tuberculosis in birds is the most prevalent in gallinaceous poultry and in wild birds raised in captivity. Turkeys are quite susceptible, but duck, geese, and other water birds are comparatively resistant. The practices of allowing poultry to roam at large on the farm, like free range, and of keeping the breeders for several years are conducive to the spread of the causal agent of avian tuberculosis among them. Infected individuals and contaminated environment like water and soil are the main source of infection. The above-mentioned Microbacterium species causing avian tuberculosis can survive for several months in the environment. Next, for a history about the disease. If there is a characteristic history of avian tuberculosis in a flock, and typical lesions are found in birds at postmortem, the detection of acid fast, especially AFB, in smears or sections from affected organs stained by the zainolhasan method is normally sufficient to establish a diagnosis. Occasionally, a case will occur, presumably as a result of large infecting doses giving rise to acute overwhelming disease, in which affected organs, most obviously the liver, have a Morocco leather appearance with fine greyish or yellowish mottling. In such cases, AFV may be not found, but carefully inspection will reveal parallel bundles of brownish refractile bacilli. Prolongation of the hot carbon function stage of zainolhasan staining to 10 minutes will usually reveal that these are indeed AFB, with unusual high resistance to penetration of the stain. Recently, DNA probe and polymerase chain reaction (PCR) techniques have been used to identify the agent specifically. Thank you.
Assalamualaikum and hi, my name is Rabiatul adawiyah binti rozlan, and today I will be explaining the etiology, the mode of transfer, and the diagnosis of avian tuberculosis. Avian tuberculosis is commonly caused by Mycobacterium avium, which is an atypical mycobacteria. It comprises of aerobic, non-spore-forming, and non-motile root-shaped bacteria that vary in length from 1 until 3 nanometer, and cords are not formed. They are weakly gram-positive and stained specifically acid-fast staining method because of the high levels of lipids in mycobacterial cell wall. It is difficult to eradicate this organism as it is highly resistant to environmental challenges. But this organism can be killed with direct sunlight as it is unprotected. The temperature ranging from 25 until 45 degrees Celsius is optimum for its growth, and the most favorable range being 29 until 45 degrees Celsius. The growth can be enhanced with 5 until 10% of carbon dioxide tension for primary isolation. Serotypes 1, 2, and 3 are considered virulent for chickens. Serotypes 1 and 2 are commonly isolated from domestic birds, and serotype 3 is recovered sporadically from wild birds. Serotypes 1 and 2 can affect animals, whereas 4 until 20 are mainly found in humans. Serovar 1 is the common organism isolated from birds and human beings. The digestive tract is the common source of infection. The respiratory tract is also a potential source of infection, as the birds may be ingest and inhale the aerosolized infectious organism. The infection is transported by contact with contaminated environment, where the cleanliness and hygiene was not paid attention to. It may persevere in soil and litter for many years, so it is important to avoid using contaminated premises for raising poultry, swine, or other susceptible species. The diagnosis of Mycobacterium avium infection is based on the clinical signs, postmortem gross lesions, and by demonstrating the acid fast bacilli in crushed lesions, which is sufficient for a positive diagnosis. If acid fast bacilli cannot be found, but the typical signs of ulcerations are present in the birds, culture of the organism must be performed. In the necropsy procedure, the liver or spleen is usually the best organs to use. If the carcass is decomposed, bone marrow may prove more satisfactory, as it could be less contaminated. Cultural examination using feces and tracheal swabs is necessary to isolate and identify the etiological agents in live birds. That's all for me.
Next, we go to the prevention and treatment in avian tuberculosis. Elimination of infection is difficult due to chronic carrier state. It's like sacrifice the flock. First thing first, to prevent the avian tuberculosis, the infected flock should be depopulated so not to continue to contaminate to environments. Using all-in, all-out management practices, which is one eggs are kept until complete production and they are populated after that. So to prevent the infection, as you can see the picture, this is the system all in and out. Maintaining good sanitary condition to poultry housing, which is cleaning feces regularly to prevent transmission of the avian tuberculosis. Other prevention is minimize stress, because stress is the key factor of the transmission. So reduce contact the birds to white birds and pig to prevent the transmission of the avian tuberculosis. Reduce key factor by improve environment parameters. By minimizing overcrowding to prevent transmission of the avian tuberculosis, provide a good ventilation to the poultry housing. Other than that, provide vitamins and probiotic to their diet to help their immune system, so their body can make antibody to against the avian tuberculosis. And the sick birds should be killed and buried deeply, so no new stock or production introduced on the farm for a year by year, because once the birds infection from the avian tuberculosis, it must be depopulated and buried deeply. Apply good biosecurity rodent control to eliminate the carrier of the avian tuberculosis. Keep flock for one season only. For your information, treatment of the infected animal is rarely because of the high cost and wasting time. Due to the fact also, because of the economical consideration, treatment is not considered a valuable option, is particularly in poultry sector. Actually, treatment is not recommended for fear of producing resistant strain. Too many medication will take months and over a year, so it's wasting time. Treated with the same drugs to treat human, actually antibiotic. So previously contaminated premises should not be used to raise poultry. Keep only one season. A complete production and must be depopulated. All bird in infected flock should be slaughtered. All equipment and housing must be destroyed. Prefer by burning or using cryogenic compound to prevent transmission of the avian tuberculosis. The flock should be repopulated with day-old chick
that not allow any contact with the old fitting environment. Diagnosis with avian tuberculosis must be placed in the quarantine for the 12 months. Always practice good sanitation and hygienic for the poultry farm. The avian tuberculosis can be treated with the several antimicrobial drugs taken regularly. So it's important to totally committed and follow the veterinarian treatment plan. So remind, prevention is cheaper than a cure.
Okay, now we continue with my part. Before I continue with my part, I want to introduce myself first. My name is Mohammad zainolhasan, rosli. My metric number is F59A0081. So, for my part, I will present about the signs and symptoms of avian tuberculosis in poultry. So, what you can see, we have 13 signs and symptoms of avian tuberculosis in poultry. The first is weight loss. Second is weakness. Third, decreased egg production. And then white diarrhea, increased thirst, dull and or rougher feathers, and then for a swollen abdomen, skin ulcers, depression, atrophy of the beast muscle, lameness, hepatic rupture, and hemorrhage due to an enlarged liver. And last but not least is sudden death. So, in avian tuberculosis disease in poultry, decreased egg production or diminished weight gain may develop in affected flock. In small flock, this often means until a few birds die. And then, when birds walking through a flock, emaciated birds will lag behind healthy birds. And then when they are picked up, they will feel lighter than unaffected birds. The carcasses of dead birds will reveal extreme emaciation with no fat reserve, dramatic loss of muscle, and prominent bone protuberance. Lesion consists of white fun masses of various sizes in the liver, spleen, and bone marrow. The last is the intestinal wall is thickened and pale, and they may be serosal masses. So that's all for avian tuberculosis disease in poultry from me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Syarifah. I will continue my parts which is postmortem. First, we can detect the birds have this disease by their characters, which is they have grayish white or grayish yellow nodules of varying size, invariably in spleen, liver, and intestines, and almost tissue will be affected. It also can affected by emaciation from the birds that already have this avian tuberculosis. The diagnosis will be in isolation microbacteria from chicken tissues. It will be tested using a TB test, which is bovine tuberculosis test. For specimen required, presence of acid fast bacilli in skin smears or sections are generally sufficient to make a diagnosis. For their transmission also, infection result from ingestion of material contaminated with feces of infected birds or other animal can contain very large number of tuberculous bacilli. Lastly, conclusion. We get limited epidemiological information on variant tuberculosis in chicken and no information regarding the public health impact of the disease. In the present, postmortem examination revealed varied distribution of tuberculosis lesions in liver, lung, spleen, and intestines that associated with simultaneous exposure by different routes of infection. Also, the underlying cause of avian tuberculosis identified belongs to genus Microbacterium. In other hands, shows the difference in the prevalence of avian tuberculosis with chicken feed supplement practice, will bird interference and education status of the animal owners.